Heart. It is a hollow muscular organ situated in the middle mediastinum inside the pericardium or enclosed in the pericardium. Shape and size. It is conical in shape and slightly flattened anteroposteriorly. Its size is that of closed fist. Measurements. It measures about 12 into 9 into 6 centimeters, that is length into width into anteroposterior dimensions respectively. Weight. It weighs about 300 grams in male and 250 grams in female. External features. It consists of 2 atria and 2 ventricles. The atria are situated above and behind the ventricles. That is, imagine this is the atria and this is the ventricle. The atria are not vertically present above the ventricles. They are present above and slightly tilted backwards so that the ventricle is projected forward and the atria are lying just behind it. So the atria are situated above and behind the ventricles. It has an apex, a base, 3 surfaces and 4 borders. Apex. The apex is formed by left ventricle and it lies at the level of left fifth intercostal space. Base or posterior surface. 2/3 of the base is formed by posterior surface of left atrium and 1/3 of the base is formed by posterior surface of right atrium. Surfaces. There are 3 surfaces: sternocostal surface or anterior surface, diaphragmatic surface or inferior surface, and left surface. Sternocostal surface. It consists of atrial and ventricular part separated by coronary sulcus. Right 2/3 of the atrial part is formed by right atrium and left 1/3 of the atrial part is formed by left auricle. Right 2/3 of the ventricular part is formed by right ventricle and left 1/3 of the ventricular part is formed by left ventricle. The anterior interventricular groove intervenes between the right and the left ventricles. Diaphragmatic surface. It is flat and it rests on central tendon of the diaphragm. The left 2/3 of the diaphragmatic surface is formed by the left ventricle and the right 1/3 of the diaphragmatic surface is formed by right ventricle. The posterior interventricular groove separates the 2 ventricles. Left surface. It is mainly formed by left ventricle and partly by the left auricle. Borders. There are 4 borders: right border, inferior border, left border and superior border. See, on the posterior aspect you can see the superior border clearly. Right border. It is mainly formed by the right atrium and this border separates the sternocostal surface from the base or posterior surface. inferior border. It is sharp and separates the sternocostal surface from the diaphragmatic surface. So this is the diaphragmatic surface and this is the inferior border. Near the apex of the inferior border, there is a notch known as incisura apicis cardis. Left border. The left border is mainly formed by the left ventricle and partly by the left auricle. It separates the sternocostal surface from the left surface. Superior border. The superior border is formed by the left atrium. It is masked by the roots of aorta and pulmonary trunk. See here, it is masked by the roots of pulmonary trunk and aorta. You are not able to see the superior border clearly.